The Tulare County Settlement Agreement is a landmark step forward, um, ensuring that people living with mental health disabilities, who may be living with substance use disorders, who may be living in house, these co-occurring disabilities within Tulare County, receive services in the community rather than being institutionalized or incarcerated. What brought Disability Rights California to even look towards Tulare County? What did we discover?
Back in 2020, 2021, we started receiving sort of alerts, right, from the community and from external partners about the certain issues with respect to mental health disabilities and sort of lack of community-based services. One of the things that we heard from one partner who was doing a lot of work within the jail system was that they were seeing individuals coming in due to behaviors related to mental health disabilities. Another issue that we were hearing from constituents was that for mental health crises, sort of the only response that the county was providing was um, involuntary commitment, which is often referred to as 5150 hold. There was sort of a lack of any other alternative, community-based crisis services, de-escalation, that sort of thing. And we were also seeing some news reports where people with mental health disabilities, were experiencing tragic outcomes. And we launched our investigation, I believe, about 2021. And so, as part of that investigation, we were reviewing and analyzing hundreds of public records and data. We were using DRC's access authority to meet with government agencies and service providers who were part of these systems. We were engaging with outreach, an extensive outreach and engagement efforts, and meeting with constituents who are impacted directly by these systems. So, as we were engaging in this investigation, we found that a lot of the reports, the initial reports that we had received, were really backed up by the information that we were learning through the investigation. In 2020, 2021, the data was showing that Tulare County's arrest and jail rates were double the state's, and this disproportionate rate was even higher for the Black population within the county. We were seeing that over half of adults who were incarcerated and nearly 80% of incarcerated youth were on the county's mental health caseload, which was it far exceeded the statewide average. In terms of crisis services, we were seeing that it was being overwhelmingly delivered in institutions. And for example, in 2020, close to 90% of crisis intervention services were delivered in an emergency department, hospital, or jail. We engaged in this investigation for about a year and a half or so and pulled all of our findings and our work with the experts and what we were learning directly from community, and drafted a demand letter, essentially bringing together our findings and also our recommendations to improve the issues that we were seeing, and sent it over to Tulare County. We've been really fortunate that Tulare County, when they received this letter and we started engaging with them, they were very responsive and very receptive to our findings and open to working collectively towards resolution of these issues. And so we entered into what's called a structure negotiation process, which is sort of a process to discuss and formalize sort of the solutions that we could agree on. The settlement agreement that was finalized earlier this year, and it's setting forth specific obligations, responsibilities to be undertaken to resolve the issues. This gave us a lot of flexibility to take into account everything we were learning from the community, taking the knowledge that was within Tulare County to craft something that was directly responsive.
The relationship that you were able to establish with the County of Tulare, and really through um, the connection that was made with the community there in Tulare, right? All the amazing providers and community partners, the CBOs, the people who are directly involved, the unhoused community, um, all of that took place, which you shared amazing work.
If you look at the settlement agreement, like the first third of it is all about mental health crisis and really ensuring that the county builds out a crisis system that is accessible to people in a multiple different ways. There's a call center people can call to get help. They can talk to someone on the phone. They can text message. If that's what's needed. We've also built out the mobile crisis teams that can actually go to folks in the community and meet with people, help de-escalate crisis, help connect to services. So the terms that we fleshed out and that the county agreed to kind of shifts that to a community-based provider, which the county is already contracted with, and they're starting to roll out a different kind of service.
The county will is required to host two meetings annually for the next 2 years to gather input from the community about what barriers they're seeing to access these programs, but also what barriers they're seeing if and when they are connected to these programs. What additional changes need to be made? On paper, these programs look great, but often something falls through the cracks in implementation. So we wanted to create a process to make sure that the community could provide feedback on implementation as well. All of these services are also supposed to be culturally responsive, gender affirming, age appropriate, right? And again, this applies to both adults and young people.
Where are we now? So we have the settlement agreement. Tulare County agreed. So where are we?
Now that we have a final signed settlement agreement, we turn to implementing that agreement, and specifically the county starts implementing that agreement. This is the fun part where the county starts doing what it agreed to do. It's already started implementing a number of the terms. Like I said, they already have the contract with the new mobile crisis teams. So this kind of implementation phase will last about 3 years. It's important to note that Disability Rights California stays involved during this part of it, but the parties have actually agreed that a third party behavioral health expert will be responsible for monitoring the county's progress on implementing the terms and reporting on compliance with the settlement agreement. We wanted to build in terms that had lasting effects. And I think the data is one of those pieces where the community, even 10 years from now, should have access to more data about what's happening, who's getting the services, where the gaps are.
We've been really focusing on setting the terrain for successful implementation. And these are big systems, lots of deep changes happening through our overarching goals in this project, making sure that community-based services are available, eliminating law enforcement. Those are sort of the metrics, right?
To you in the community, like this is your settlement, like should feel good about this result, and it's part of a collective effort.
Well, it's been wonderful, getting to know community and just how generous they've been with their knowledge and their time in getting us up to speed and sort of guiding us through this process.
I mean, I love it all. I'm like enraptured, right? Just thinking about the thoughtfulness in the advocacy to support the mental health community in Tulare County. Thank you, Disability Rights California Mental Health Practice Group.